Hey YouTube, my name is Rick Gossman, and I have been diagnosed with the squamous cell carcinoma of the throat and right lymph nodes. I'm creating this video to help people that have been diagnosed with the same thing and document what I'm going through and how I went through my treatment. So let me give you a little preview of what's happening. I just started my therapy today, so I've started day 1 of 35 days of therapy. But what you need to be aware of is the fact that there are 3 or 4 weeks of procedures that you're going to have to go through. You're going to have to see a dentist, get your teeth looked at, a cancer dentist. You're going to have to see a throat specialist for swallowing. You're going to have to see a nutritionist. You're going to have to see a medical oncologist, surgical oncologist, and a radiation oncologist. It's 3 weeks of scheduling appointments and getting everybody in a row. I had a chemotherapy port installed and also a feeding tube put in, so that if I cannot swallow during therapy or I cannot eat, that I can use the feeding tube as an emergency backup. Now, I don't intend on having to use it, but we're going to see how it goes. So over the last 3 weeks, that's what I've done. I've been going through treatments, trying to get everything together that we can do. Did a lot of research over the last 3 weeks, and let me tell you some of the things that I'm going to try, and I'll let you know how they work. One thing is for coating your throat during the radiation burning. You can buy liquid aloe, 100% liquid aloe at Walmart, and get it and put 2 tablespoons after your treatments, and that will help coat your throat and heal the inside of your throat as you go through radiation therapy. One of the other things that I have found out, and we did a little research, is MD Anderson Cancer Clinic in Houston, Texas, did a study. And their study says that during doing acupuncture 3 days a week while going through radiation therapy should help save the salivary glands, or at least give you 60 to 80% production back. So I am doing that. I am doing acupuncture for salivary gland reproduction 3 times a week during the 35 days of radiation therapy, and I will keep you apprised on YouTube how it goes. Other than that, I'm ready to start therapy. I started today, had my first radiation therapy. I'm telling you that mask is going to be a little tough to take, to get used to. It pins you down to the table, and you'll get your mask made, and you'll get scanned into the computer a couple of weeks before you start therapy. So it is manageable. Now, I was not given a choice on whether to get a feeding tube or not. I would recommend that, even though it is a surgical procedure and it hurts to get it done, you're sore a couple of days afterwards, it's better to have it and then not lose too much weight. Right now I weigh about 238 pounds. Probably put on a few more pounds over the last 2 weeks. I've been doing my bucket list of favorite foods while I get ready before I started therapy. So I'm going to put this out here. I'm going to do 9 weeks. I'm going to do this video and then the 7 weeks of therapy. And I will keep everybody apprised week to week on what works and what doesn't work. I'm going to try different foods, different things that I can eat, different flavors and tastes. And so as I go along, I hope these videos will help someone else figure out the best way to handle their squamous cell carcinoma of the throat and manage their treatment of radiation and chemo. I am doing 3 doses of chemo 21 days apart. Instead of once a week, I'm doing 3 big doses. I think at my age I can handle that, and so that's what I'm going to try to do. So I will keep everybody apprised. Stay strong. You can get through this. I know I'm going to. And I will see everybody next week. Thanks.